Glad you're here. Buddy else. Well, thank you for coming to Rotary, and we've got a full room, got a great speaker today. And speaking of speaker, I got started about 5 minutes earlier than normal because I saw he has 83 slides. So, well, let's get with it today. So, what is the prestigious 105-year-old Rotary Club of Fayetteville, where we start the meetings with a four-way test of what we think, say, or do? Is it true? Well, will be beneficial to all concerned. You may have a seat. Our singer today, our song leader, is John Harrell. America is beautiful. Oh, beautiful, love for Spain, the sky for for love of my son. Facing because God shed His grace on me. I'm proud, my good. Please pledge, please. Oh, please be right. All rise for the pledge. Pledge is the allegiance of the flag from the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. You can have a seat. One of the things the Rotary talked about is when they're and I thought this was very important. There you go. Today is in the Holy Week, the Christian faith, Monday, Thursday. It doesn't mean necessarily that I confused that it was Monday or Thursday, but that is the Monday is the Latin for Paeum, which is also mandate or commandment. And Jesus has said the new commandment I give to you that you love one another. I think involved in that is also service with the Lord's Supper and also the washing of disciples' feet. And so since Rotary is about service above self, that would be appropriate for today. So we have an Easter message, and Jesus is our ultimate example of service above self. Christ the Lord is risen. Hallelujah. Every for us say, hallelujah. Praise your something, something. Hallelujah. Love speaking worship. Hallelujah. Thank you. Thank you, John Harrison, Pittman, Sergeant at Arms. We got more than one class. We're going to do classes. I missed everybody. Glad to be back. All right. Visiting Rotarians. What do you call them? Where are you at? Behind them. And then members of guests, we have one, Blake Penny. Virtual agent with students on virtual safety.
You have to be sure to check out Blake Pennington and Christine Football on Good Morning KNWA or Good Morning NWA this morning, talking about our pickleball tournament. Great interview. All right. So I know you're gonna be sad about this, but I accidentally deleted my Fresno County Farm Journal. I tried, and they don't put it on, I couldn't find it, I emailed it, you didn't get back with me yet, so I got it, plan B. This is absolutely a true story, happened in John Creek, Portland. This kangaroo justice place. So here's the joke. There is strong evidence in this trial, defendant's on trial, guilt is obvious, but there's no court. Makes it a little tricky. They're trying to get a conviction. And the defense disclosing statement, the defendant's lawyer, he pretty much knows his client's guilty and trying to find a Hail Mary here. And he resorts to a very clever trick and tells the jury, in 60 seconds, the person that you think is dead is going to walk through that door. And so they sit there for 60 seconds and obviously nobody comes to the door, but they're glued, they're rubbernecks over. And in some closing arguments, he says, you had a doubt. You weren't convinced that he's actually dead, and that's the reason for doubt. And they go to the lift break and they come back and they say he's guilty. Of course, he asks them why, and the juror foreman says, everybody look but your client. As we have here today, as members of Rotary, we pray that we are ever mindful of opportunities to render our service to fellow citizens to our community, keeping in mind always the enduring values of life, exerting our efforts in those areas, and upon those things which future generations can build with confidence. Let us continue to strive to make a better world. Amen.
Thank you, Harrison, and welcome to our guest. All right, Rock. Okay, no history today. You need to speak all you. No, I haven't heard from him. Hope he's okay. Somebody needs to check on him. Okay. All right. Any volunteers for a history lesson? Last chance. What did I look at this day? Well, I'm just going to picture. Pickleball's coming. It's just a few weeks away, so you probably got an email this week from Jimmy giving you another chance to be a sponsor, or at least I finally saw the email, and I am now a sponsor. So thank you, Jimmy, for the reminders. Let's talk about this week, the next nightclub. You ready to talk about this? Of course, they want to talk about it.
Do I need to come to the front? Oh, okay. Nightclub next Tuesday, April 7th, from 6 to 7 at they're going to do a service budget for these. As I said before, they have their big. They host every year. I believe it's called Handshake NWA. It's for materials, but 6 to 7. It's next Tuesday. There will be light snacks and drinks. Please come.
Please welcome Dr. Kenton Ross. The truth is, I didn't send a bio in. I'm Rotarian of the month this month. I was taking care of everybody else. I didn't send anything in. But that does not slow Harrison down. He will find a bio on you somehow or another. So Harrison, if I don't do it now, he's going to make me do it later. I have to tell a dental joke. So this is the club of not only lawyers, but judges. And they are so hard to work on. Every time they come in, they make you raise your right hand. It's where to pull the tooth. Those are about to. We're going to tell no one on Zoom, but I'm not even remotely funny. So then we'll get you on the way home. All right. So we're going to talk about sleep and start breathing today. My plan for the month is we're going to talk about sleep and teeth. And so mine's going to be a little bit of an introduction to that. Next week, we're going to have Elspeth Bath, who's a licensed social worker and specializes in cognitive behavioral therapy for insomnia. However, we find out 40% of our patients that have sleep disturbed breathing also have difficulty sleeping. So she's going to give you some tips and tricks on how you might sleep better, or to recognize if you have an insomnia problem, you want to look for some resources on how to do that. And then after that, I've got Dr. James Robley coming. He's going to share with you some new frontiers on orthodontics, actually changing the structure of our face. And so dentistry has evolved from being sort of tooth-centered to being full face centered, wellness centered, all these things. So I'm going to take you through some of how that's going to, why that's all relative. And this is a 5-week month. The good news is that you only get 3 weeks on teeth and breathing. Shannon Jones from T2, and she'll take you through T2, Theater Square, T2 season. And then my lovely wife, Jennifer, will do the final program on April 30th. And she's going to take you through the new Broadway season that's just been announced and some art center to hear all that good stuff. So let's get into this. So sleep, stir, breathing. I think the title I gave you was teeth, sleep, and wellness. And to the uninitiated, those are 3 seemingly unrelated terms. After this program, I hope you'll see how they tie in one another. So this is my crew, and we have just over the years evolved into treating a lot more sleep patients. This was one of those things that kind of came to me. I didn't seek it out. I had a brother that snored early on and made him a sleep appliance ages ago, and it was unsuccessful. And I kind of said, enough of that. And then I had my father-in-law was having AFib, and I said I learned a little bit more and realized that this breathing thing actually ties into AFib. And so I said, listen. And I'm that son-in-law that was an idiot to him, and that's okay. So he said, I said, you don't have to do what I say, you have to tell you what I say. We had learned to do high-resolution pulse oximetry screening. So you've all had a high-resolution pulse, or you've already had a pulse oximeter. High-resolution just means it takes it every second, it does it all night long. So we tested him 74 minutes. He stopped breathing. So that's where his AFib originated. I'm sure there's some other things that contributed to it. So once you see that and you catch that, you can't unsee that. So I've had probably 10 years worth of training now in sleep and outfits in the dentistry. I'm a dentist. It's important to understand. I'm probably going to get ahead of myself, but I'm not making this diagnosis. So here's our team. They're all very sleep aware. And so I'm going to share a personal story. I have a pointer on here. So this is Angel. She's our hygienist. And she shared a personal story with me about her brother Daniel. So Daniel's healthy, 46-year-old. He's not overweight. Seems like your average guy. He was 46 years old. Didn't get up one morning. And Bob was called and checked on him, and sure enough, he had passed away at 46, sleeping on his couch. And they did the autopsy trying to figure out what was going on. It was not a heart-related thing. They couldn't find anything else. He'd had a couple of beers. Medical examiner determined he'd also had not a diagnosis of sleep apnea because he refused to go to the sleep doc, refused to wear the CPAP. But his sister had made him a bite guard, so we knew he had some sleep-related issues. And the medical examiner determined his death was from sleep apnea. So that was the personal story that, again, once it's in your practice, you can't ignore those kind of things. Doesn't happen often, but it does happen often enough. So what is sleep-disturbed breathing? So snoring is not a diagnosis, it's a symptom. Something that you hear, basically turbulent air. So air can't get through the nose and down the throat without a clear pathway. It becomes turbulent. That makes everything flop around back there. So that's snoring. Sleep fragmentation, also known as upper airway resistance syndrome. So to simplify things, the upper airway is basically your nose becomes whole. And if the air can't get through that, there's a restriction there. Diaphragm doesn't really care, it's just pull hard. So if you've ever tried to suck a malt through a cheap straw, that straw collapses. That's your airway. So when you have upper airway resistance, you'll see that airway begin to collapse. So we used to stereotype patients and say that old men were traditional swimmers, young fit females, and kids. Those were the three groups we talked about. We learned that it really doesn't matter what you look like. Anybody can have these issues going on if they have some upper airway resistance syndrome. And then, of course, obstructive sleep apnea. This is that airway is completely closing down. So, your bed partner stops breathing at night. That's what we call the elbow test. If you're running it or roll over because you're not breathing. And then central sleep apnea, if you have OSA for a while, those receptors in your throat start to attenuate. They burn out. They don't work as well. And in a sleep study, when we're monitoring whether or not air is moving in or out, that is when you don't even try to breathe. The brain's just kind of said, forget about it. That's a central sleep apnea. There's no effort to breathe. And so other things you might know about are insomnia, circadian rhythm, sleep disorders. So traveling a lot, your natural biological clock is reset. The best way to reset your natural clock is to watch that sunrise, get some of that red light on your retina, just a few minutes in the morning. Narcolepsy and other hypersomnias, parasomnias. A lot of this stuff starts in kids. Anthropologists tell us we're not growing our airways out like we used to, so kids can have these issues as well. And so how common is this? So those are the official numbers, 37% of men, 50% of women. However, we think 80% of it's undiagnosed. It is very common. And so how would you know if you have it? So you might notice failing elbow test that we talked about. That's the first sleep study we all get. Difficulty falling asleep, difficulty staying asleep, having to pee during the night. So this is one of the things that my father-in-law pointed out to me, even though we'd saved his life. The thing he was grateful for is he didn't have to get up pee anymore once we got his airway working again. So when you sleep deeply, you secrete anti-diuretic hormone, keeps your bladder from filling. And so if you're not sleeping deeply, you're staying in that level 1, level 2 sleep, your bladder just fills up like normal. And so this stuff all too often in the past, it's not as odd anymore, but it's just gotten written off. They problem. Oftentimes there's a sleep problem there. And that's one of the first things I look for when we make an appliance to do somebody's job for is how many times you're getting up to a pee at night. That quite frequently improves. So nighttime reflux, you can imagine with reflux, that's not good for your teeth. You're going to get acid on your teeth and grind your teeth and fill at night, and that's why dentists have become the front line of watching for obstructive sleep apnea. See these teeth worn down, crack. Now we know why. So fatigue, obviously, if you're tired or more times sleepy. So recliner short. Go to sleep while you're talking about recliners. An issue. That's a little tired. Dry mouth, sore throat upon waking, fatigue, sexual dysfunction, and of course, dental problems like cracking more teeth. We found out most of our treatment female patients that are T&J patients are actually airway patients. So we get that under control and improve the jaw situation. Or a narrow smile. That's the thing you begin to recognize. This is a narrow frame. I have not had mine expanded yet. I'm 57 and we're on new frontiers of what we can do with adult males, but it can be done. So I've worked on a couple of cases now. I've seen orthodontists, a 57-year-old male weightlifter orthodontist, big charts, and we can expand them non-surgically. And that's what Dr. Rowley will hopefully share with you in a couple of weeks. So only a physician can diagnose sleep apnea. Just like I take your blood pressure when you come in, I'm not going to diagnose you with hypertension, but we're already to a specialist or a physician. They're going to make that diagnosis. Same thing with sleep. I'll show you for sleep issues. We'll typically work with Washington Regional Dr. Eccles to make that diagnosis. CPAP is their gold standard for treatment. They'll send you back this way. So, you may be thinking, why am I just now hearing about sleep? Sleep apnea, those kind of things. So it's a relatively new specialty in medicine. It wasn't getting any full accreditation until 2005. There are only about 7,500 sleep specialists in the U.S. compared to 200,000 dentists. The link between high blood pressure and obstructive sleep apnea first get recognized in the 80s. And CPAP was invented until the 1980s. This is what it looked like. So I've got a video. Have a make a video play on here. Or will it work? Let's see.
No, it's not on that computer, it's on this one.
Oh. See if it'll play this. And. I'll back it up and turn it all the way up. Oh. Hold on.
I'm sorry, kid.
That's
I
okay.
wasn't ready for something.
We didn't talk about it, so I took this video at, Stanford. It's trying over there, at Stanford, University, California. And they had the world-renowned sleep clinic, and that's kind of where things started fast. That thing sounds like a 1970s back. And we're supposed to sleep with that, in the early days. Today, I've seen the CPAP machine is fairly quiet. They make all the difference in the world. So the early 1980s, this was everybody in the world that was about sleep. And so obviously more standards. I mean, it's standard. So looking back at the literature from 1923 to 1906, 518 total research papers that have been written on sleep in 86. In the first 63 years of research. And so, first 80 years, 34,000. And then in 2025, we had 17,000 studies alone just in that year, so almost 80,000. And now we've got a total of 143,000 studies. So you see the kind of the way the research has gone on sleep. So we as I say, we, my profession knows more about sleep than we've ever known before. So what do we learn? We heal when we sleep deeply. So high blood pressure was kind of the first thing that they related, but now we understand heart disease is related to sleep apnea, diabetes, mental health issues, ischemic stroke, and congestive heart failure are all sleep-related things. So how do we diagnose it? So we screen for it. And this is what our high resolution pulse oximetry reports look like. So one of the nice things about your dentist or your physician is we get 3 nights of this. Going for a sleep study, typically you get 1 night, and you're sleeping in somebody else's bed. How do you sleep the first night when you're staying in a hotel? Sleep lousy, right? So it's tough to get a diagnosis. They don't need you to get a full night or a 2 nights sleep. They just need a little bit to see what happens with sleep cycle. So if you do get prescribed a sleep study, I would say you plan on going home and going to sleep after the sleep study. You're not going to sleep a lot or sleep well in the sleep study. They can still make a diagnosis. But this goes through and we look at the oxygen desaturation greater than 4% in a 3-second period of time. That is a conservative estimate of an athlete. So we can screen for that. Your physician can screen for that as well. It's very cost effective. Epworth sleepiness scale. It's one of the other nice things about this, bringing medicine and dentistry together. This is a medical form that dental officers use all the time. Stop thing is another word overtaken. Pediatric sleep questionnaire as well. Yeah. That go through kids and go through those kind of things. So the one thing you need to know about kids is kids should not snore. So if your grandchild or child is snoring, that needs to get checked out. That's not what we're supposed to have. With us, somebody had to draw a line somewhere of what is obstructive sleep apnea as far as diagnosis. So the diagnosis is 5 or more apneic events per hour for adults. I don't want any apneic events per hour, but that's the diagnosis for kids. It's a single apnea. That's the diagnosis. Yeah. Right? Yes.
What age?
Honestly, under 18. I don't think any of us ought to support. That it's not always achievable. So, but that's the kids should have no parent. We're eating. That all this goes. We're eating a soft diet, and that's why the kids' roof of the mouth, as opposed to the roof of the mouth is the floor of the nose. So if we don't get that to open up, then the nose is smaller than it's supposed to be, and the air gets trapped, so. You can Google pediatric sleep questionnaire, and it'll take you through things to look for in your kids. So, talk about that. Whatever treatment, so CPAP, 5PAP, APAP, those are all, the gold standard, there are different versions of the same thing, some machines only blow, some talk blow, some like, you're gonna time it right, if you're ever trying to get challenged. If you fail at CPAP, you're not alone. Successful, gain acceptance is about 30%. My advice to you would be don't give up. Work with the therapist to get the right mask, and nasal pillow seems to be the one that most people are most comfortable with and can fit you well. So there are over-the-counter upper airway resistant aids like nasal strips and dilator. Those are Walgreens across the parking lot here. Weight loss, every sleep study I've ever read says lose weight. So, alcohol avoidance can be terrible for sleep, especially excess. Positional therapy, that's raise the head of the bed a little bit, or get your pillows like they need to be. Sleep on your left side. Lifestyle changes such as regular exercise. Middle-based orthopedics is what Dr. Rose talks about. Mandibular advancement appliance is what I make. There's probably 350 different versions of this thing. They all do the same thing. They pull the lower jaw forward off the back of your throat. And then jaw surgery or jaw advancement. So that's surgically going in and moving the jaws forward. We rarely use the word cure, but we do. That one gets thrown around with jaw surgery. Hypoglossal nerve stimulator, HNS, you've probably seen it as for Inspire. So that's a pacemaker basically that goes in your chest. They run a wire up to the bottom of your throat to your hypoglossal nerve, which activates your tongue. So it waits for you to say, if you're trying to take a breath, the doctor, I'm doing something. If it is, then it fires that and it pulls the thing out of your airway. You can set it to turn on 15 minutes after you try to go to sleep. Yes.
Question, everybody, why not the right side?
So, yeah, with back foot gravity is the reason. So on the back side of your tongue is an airway dilator muscle. On your back, you're pulling that tongue back to block the airway. So kind of worst position to sleep in is as far as airway goes. Your right side, it has to do with the way your stomach is wired or plumped, I guess. And so when you're lying on your left side, your stomach stay in your stomach with the right side. Also, that's more like it. Right side, the left side, stomach contents. Your side. Also, your stomach's got falls back to the back of the throat. Yes, yes. So sleep on your left side is ideal. Yeah. And that may require a certain, or, we raised up the head of our bed a few degrees last time we bought a mattress. Sleep with the head elevated, so. And then tracheotomy, you can imagine, just absolutely cannot fall asleep without walking off. You have central sleep apnea. You're going down with that area, you can't sleep out. You have to put a hole right there in your throat. Where you do that. Not a good situation. All right. So additional supporting options, myofunctional therapy, physical therapy for your airway. Myofunctional therapists. They have those different exercises that you can do to tone the muscles of your airway, just like arms and legs. And that can be effective for a lot of pathological exercises. So simple things like pushing your tongue in. One last was to pull my button string, put it behind there. That strengthens those muscles. So there's several little things. What I found with this is if you do it, actually has some down your physical therapy. I know it doesn't work. This is one of the and then cognitive behavioral therapy for insomnia. So sleep reset is an app that you buy and attach to a therapist that's going to help you learn how to sleep better. Calm and Headspace are a couple of free ones, or you can upgrade like one of the apps and just have your headphones on you know, whatever, you kind of talk about sleep, to relax and get your mind off what you're just thinking about. These are the over-the-counter aids that we talked about, so this is the one I use, it's called Sleep Well. This is soft silicone, it's my, well, Jennifer, my wife likes this guy, so it's just shape, chips design. These are common one, there's probably a dozen different ones out there, different price points, each of those top ones are $20 a piece. I have no partial interest in anything. So, good right strips, so if you want to, understand. Strip right over the nose, if you're watching NFL, the receivers, like that. We get nitric oxide, more nitric oxide, we bring our toes. Or now, nitric oxide, your body's own natural basal dilator, so helps up your blood vessels, blood draining system, down where it needs to get to. And then, thing two, this is the appliance I make. It's basically an upper and lower retainer with a couple of knobs on either side, and those straps come in different lengths. So what we're doing is bring the front teeth together and like that. So that's how much advancement we're shooting for. Don't go too much. And so that's since your tongue's attached to the lower jaw, you bring your lower jaw forward, it opens up the airway. And so there's a diagram kind of showing your question about the tongue falling back when you're lying on your back. And diagram's off a little bit. This is person's head's still up. It's typically done over. That's not what we're doing. Then we're back of chin going down, front one closed. And so when we bring the airway, the jaw forward like that, it opens up the airway. And then, so where do we go from here? There we go. Genetics, we can't do much about that. It's hard to dealt with, and those play a big difference. A big percentage of the health that you have is genetics. Diet, cleaner and eat less, and take care of what we're eating. Of course, exercise. Exercise gets your heart going, pushes your immune system out where it's supposed to be, has all kinds of overall benefits. But I hope you'll add to that. Our research is for that. Sleep, that's the next part of that. Because we heal when we sleep, if we don't sleep, we get sick. If you Google diseases related to sleep, you'll see even cancer. If we all, I think you guys understand about cancer, we all get cancer all the time. Immune system through tumor necrosis factor alpha and all the rest of those guys went find the cancers to kill it. We never know we had that cancer until it shows up and gets captured our immune system. So thorough sleep is how we're going to heal in ways that we'll never know. So I think that's it. Please set his hand up first. Yeah, great.
Okay, then, getting up to pee at night. Now, question is, how long do you have to sleep before that's a problem? In other words, if you get up at 7 hours, is that okay?
Well, you know, fantastic.
James Nestor, which, a lot of it has to do with, I follow the plan, taking your mouth shut and doing everything you can do to keep the breathing from your mouth. How does that play in there?
Well, that's a great question. Everybody heard the question, how does keeping your mouth fit into all this? And all that, the screen I had there with the things you can buy over the counter, right? 3M micropore tape. And so we talk about what Dr. James Nestor is a medical journalist. His father-in-law was a pulmonologist. Yeah. So he had a good resource in that. That book came out in 2017, and it's a great layman's level picture of what this works, physiology behind it, how medicine is taking forever to figure this thing out. Still hearing about this, and some people haven't heard about it. But sleep tape, basically, think of it as a respiratory therapy technique to provide you breathe through your nose. It's controversial because there's not a lot of research around it. There's not a lot of research around it. There's no money to be made at that. It is cheap. And so basically, it's taking, he talks about a postage size tape. I want a 3-inch long piece of tape. That is a medical tape, like you tape an IV line on. So we're not talking about tape. So if you get your lips slightly apart, and if you're new to this, it's a vertical tape. And there's tons of products. Chin straps, actually coming up. There's lots of ways to go about this. But it all gets back to that more oxide. Now, when I was at the Ortho Patient Sleep Society gas station, where they showed us, ENT showed a study where they measured the side versus that tracheotomy. It was twice as much nitric oxide and then almost none through your throat. So we make nitric oxide ourselves physiologically, but we also get much like bacteria on our respiratory tract anyway. So that's the two mechanisms that you get nitric oxide. So basic breathing, basically what we say is unless you're exercising, working out, you breathe through your nose. Filtering the air, more nitric oxide, all those kind of things. When you fall asleep, see people around, mine just come more nose and fall asleep. So I have too much information. I've used sleep tape probably a decade now and have had no problem with it. And my wife watched me for 2 years thinking I was nuts. And then she tried it and she never looked back either. So it's when you wake up and feel better, that's, something that people should wake up better. And so, we say this, and I guess I should give a disclaimer that I'm Dr. Dennis, and I'm not sure physically talk to your provider, make sure it's the right thing for you. Not everybody probably needs to be taking their mouth shut at night to talk to your physician. See what we are. But for the day we got.
A couple of things I didn't really mention that used to be kind of a go-to for second breathing consolation.
Yeah. So in kids, a lot of times that is our first line treatment. So if you've got a 3, 4, 5-year-old just struggling, and you'll see it in the hopefully James Rowe will have a picture of that. But they're walking around and then also reach down like that, and they're just trying to breathe. They've got sort of dark circles under their eyes. So we see those kids, we know that there's an immediate problem, and tonsillectomy is often the treatment to it. The adenoids will come back, tonsils won't, but the adenoids will come back. And so we do that frontline treatment, but then we need to start expanding that palate, giving them more room to breathe, get them going on some occupational therapy, and try to strengthen things. If you're trying to teach a 3 or 4-year-old something, it's difficult sometimes. Yeah, be persistent, keep going with it. That myofunctional therapy can go on with kids and help them develop the habits. Closure. There was George Caitlin's artist who wrote a book years ago. He has art in crystal bridges because he was going around painting Native Americans. And the Europeans were considered ugly Europeans. They were wrinkled and stuff like that. It's kids, mouth was and all these big wide arches. And so anthropologists have looked at 95% of the skulls that have ever been dug up on this planet had straight teeth, including regular teeth. How many of your kids need braces now? 75% of them need braces now. How many wisdom teeth now? 95% of them need wisdom teeth now. I used to think that was aggressive treatment when I started practice. Now, just the rarity with which I see somebody that actually has wisdom teeth that they can take care of is almost that 5% of the population. So treat them out at 16, but 7 complications to take them out later in life. Did that answer your question? Get that right? The one I just mentioned was called Showing Your Mouth to Save Your Life. So that's an old one, probably hard to read. Free Spread. Yeah, by James Nestor. It's probably the one you get now. It's easy. He's due for a revision of it. He's got a couple of other books on free diving. These guys can hold it for 15 minutes. They work up to that. Yeah, all of that. Yeah. phenomenal what people can do when they put some effort into breathing. Most of us don't even think about our breathing, we just breathe. But if you think about it, it does some amazing things. Our brain regulates our nervous system when they're breathing. So when you're in a nervous situation, somebody's confronting you, whatever the threat is, you're typically shallow breathing, 1 to 3 seconds, in, out, in, out, in, out, in, out. What does that do? That signals your kidneys or your adrenal glands to shoot out epinephrine, cortisol to get you ready to face the saber-tooth tiger, the run from the bear, the whatever it is. So you're ramping up that sympathetic fight or flight side of your nervous system. When the bear goes in the other direction, and that's your brain saying, you're no longer in the fight, let's go back to grazing, relaxing, whatever we're doing. And that long inhale, with an even longer exhale, and if you hold it for a couple seconds at the top, will turn up that parasympathetic side of your nervous system, the rest, relax, membrane side of your nervous system. So that's a nice thing, the way to put a handle on controlling your nervous system just with your breathing. And then kind of catch yourself, set an alarm on your phone. It goes off, how am I breathing? I'm sitting here panicking, going through these emails. So stop, take a big long deep breath in through your nose, hold it for 2 seconds, say an 8 to 10 second in, hold it for 2, 10 to 12, 15 seconds out. The gurus that do this stuff, they can take 30-second inhales and hold it for 15 or 20 or 30 and 30-second exhales. So they're really controlling their nervous system with their breathing. So you're not going to stop breathing. You're always going to breathe. Airway is king. Roger.
If you utilize these remedies that what they are, and especially the CPAP, is there an increased danger if you stop or away from those and can't access them? Is it the increase your risk?
Well, I always think the thing that increases our risk is none of us are getting any younger. And so as we age, if we're not doing that myofunctional therapy, we're losing tone in our muscles and our collagens that do our collagens that do because of lifestyle things that can influence that. But so I would say yes, there's increased risk. I don't know if it's starting and stopping the or just marching on. But yeah, if you've been diagnosed with obstructive sleep apnea, that means you're not breathing for part of your night. And if you do that long enough, that can evolve into that second sleep apnea, where you're just not getting the same. So when you're somebody that died peacefully in their sleep, they had a heart attack while he was asleep. He was probably not, or she was not peacefully sleeping, they were probably gasping for air. Heart went through a clot or whatever, the heart stopped, or had the stroke or whatever it is. So, yes.
My mouth. What is the cause of that?
Lots of things contribute to dry mouth. Medication is probably one of the biggest ones that's out there. But if your lips are coming apart and you're breathing through there, you're evaporating that moisture out of your mouth. So it's an indication to say, oh, dry mouth. You get up here and try to talk about everybody. I'm dry your mouth up too. So guys say, anxiety producing is dry as well. Medication is probably the main one we see. Yes.
That has a lot of breathing. How does that help? Is it some part of the therapy sometimes?
It certainly can. One thing is that giving your reps in, this becomes normal. You can sit here and I can sit on the awesome and take a long weight, activate my muscles, take weight off my joints and breathe for my. So those are the kind of things that you're standing at the grocery store, but make sure your lips are together. Long breath through your nose. The yoga just is a practice, it's a coach, it's a habit that you're doing again. Right.
Can you repeat that time? I've read about 5 second in and the 5 second out.
Yeah.
The 15 seconds?
Yeah.
Yeah.
So
You have to build up.
the book, yeah.
Build up.
You have to build up to it. The breath has breathing exercises. One of the spots breathing. And 5, 4, 5, exhale for 5. That's what the sniper shoots. That's what the sniper shoots. So they're fine.
I worked with truck drivers.
Yeah.
And it was supposed to have soup.
Yeah.
Yeah, so sitting around, shift order, changing shifts all the time. Part of the tories for having that is a problem with that. So yeah, anything that's keeping you sitting there. How good. Any more questions?
Well, thank you so much. I have a lot of questions and a lot of comments. I'll give one comment. I can't imagine there's any, single men that ever have this look at, right?
Certainly a risk factor.
Well, thank you so much, and it's my pleasure to present to you this rampaging Razorback on a rotary wheel, hogging a cog. I hope you'll display it proudly in your office. Thank you, Dr. Harry, are we going to break that into a week or two? Okay, but just, I want to break the trend a little bit because there's a special birthday coming up. It's tomorrow. It's a milestone birthday. Harrison, how many is it? 50. All right. Well, that's amazing. One more. Let's sing birthday. Happy birthday to you. Happy birthday to you. Happy birthday. So. To you. Oh, that's right. Hey.
Within the past week.
Within the past. You don't look a day over 90. Yeah.
I had to clear up my sinus. I had breathe through my nose in a decade before this happened even harder. Yeah, to get this going. Right, you gotta be able to get in there. Yeah. I'm glad he did that for you. That makes sense. Yeah.